Welcome to the CanaCard Patient Management System. End-to-end technology solutions providing safe access to medicinal marijuana treatment in Canada.
What we want to get to is a personalized medicine. And so what that means is understanding how we can personalize the care of a patient based upon their medical history and their needs for treatment. Kind of the world in general is looking for hyper-personalization. So I don't know if you've noticed, but on Google now, there's the predictive searches are coming out. So the goal for Google is to really understand what you're going to type into Google before you know what you're going to type in. So that's the next generation of hyper-personalization of care for the retail market. Now we want to get there in the medical market too. We can't do this with small steps. You really have to take a leap and then build the scaffold back for everyone else to come and follow. So Google did this, Facebook did this, looking at the world as intertwisted graphs. We're doing this in medicine. So this is the graph of medicine. It's kind of an interesting concept to put all of medicine together in a three-dimensional or four-dimensional graph, if you will, that relates signs and symptoms, disease states, lab values, genomic data, everything together in an intertwisted three-dimensional web. What we can do with that is really understand how to best treat a patient. So think about a person with chest pain. If the person's an 18-year-old young boy or young man, their graph looks like this. If they're a 60-year-old gentleman, their graph looks different. So the differential diagnosis, the cause of chest pain in an 18-year-old is different than in a 60-year-old, right? We all know that that's most likely different. In the graph of medicine, we can see there's a difference. And we can use that to help predict outcomes, help predict tests, help predict what's going to happen to the patient. So what we really want to do is understand how to do this using the cannabis, making a medical graph of cannabis, if you will. There's some debate right now, as of just a couple of days ago, a statement by the Canadian Family Physician Association said that there's not much information, not much data behind the use of medical cannabis. And so these are some studies that there are studies out there, but there's not that many. And this is something that we're all looking to do together, I think. We're aware, this is Dr. Lemire sent out a notice saying that basically physicians are in a difficult position. So physicians who prescribe medical marijuana are in a difficult position in Canada right now. And the reason being is that they're basically saying they acknowledge there's a lack of evidence and solid evidence, but there's also the right to prescribe, and there are certain conditions that do warrant prescription. And so, for instance, he was talking about back pain and fibromyalgia, however, also opening up the possibility to talk about multiple sclerosis, cancer, shingles, neuropathy, and injuries as well. So there's a landscape that's confusing for us as physicians here. So the question is, what do we do about this? As physicians and really as patient advocates, what do we do? And really the answer is we want to go back to the roots of data and put things together here and really look at things like clinical trials, hyper-personalization. So hyper-personalization is a funny word, but it's sort of like, how many people have searched on WebMD for something? If you type in fever and headache, it says you either have a brain tumor or you have a common cold, right? So that's medicine. Personalized medicine is when you type in fever, headache in a diabetic who has a hemoglobin A1C that's a little bit elevated. Now you get a more specific answer. Hyper-personalized medicine is where you type in fever, headache, diabetic, A1C of 10. They're wearable and that's in their pocket. Says that their vital signs are heart rate of 120, blood pressure 90/60. Now you really know, you're getting granular. And now you know if you add the genomic data and you add that the patient is on medical cannabis, is using other medications, being prescribed other medications, has not taken their prescriptions in 3 or 4 days. Now you really drill down to hyper-personalization. That's where we want to be. We want to really understand regulation. We want to embrace regulation. I never thought I'd actually be saying that, right? To want to embrace regulation. But that's an important part of this, is to understand regulation, embrace it, and really design a system that works well in the system. So transparency, security, data security, standardization of the security, analytics, and of course increasing the knowledge base. Right? So we want to create together a graph of medical cannabis that's analogous to the graph of medicine. So how many of you guys have a credit card? All right, everyone. How many can look almost in real time online to see your purchases? Almost everyone, right? How many of you have had labs or seen a doctor in the past year? Probably most people. And how many can go on the internet to see the results or the notes in real time? Nobody.
Contact CanaCard for more information or for a live demonstration of the CanaCard Patient Management System.